Welcome, everybody. Thanks for joining us today at the World Health Network. We are here again this month of March for another town hall. We have plenty of updates for you, unfortunately. Uh, we're going to be covering measles, of course, COVID, H5N1, and a US topic. Some of our public health policies are really under threat. So Eric Feigl-Ding will be covering that toward the end. I encourage everyone to put your cameras on so that the speakers and your other members here can see you and we can have an interactive experience. Throughout the talk, if you have a question or a comment, you can put a brief one in the chat, and I will relay those to the speakers. So the speakers today, we have special guest Dr. Joe Vipond from Alberta, Canada. He's an emergency room physician and environmental and public health advocate. So we're really glad to have your time today. Joe, I know it's a busy time in the ER these days. Of course, we have our co-founders, Yaneer Bar-Yam and Eric Feigl-Ding, also here to speak with us. So let's get started. Joe, what are you seeing in the ER, and what kind of data have you been observing as this measles outbreak unfolds? Oh, and also before we start, everyone can put their location in the chat so we can see where everyone's from. I love that. So just go ahead and put your location in the chat. You can find the chat. It's an icon at the bottom of your screen if you have the full desktop version. All right, Joe, I'm going to spotlight you, and you can introduce yourself and tell us about this measles outbreak.
Sure, I'm happy to chat, and I just want to maybe kind of do a backwards bio. So, sometimes people have their bio as look at all the great things that I've done, and I just want to do some caveats. I'm not an infectious disease doctor. I'm not an epidemiologist. Fortunately, we have one here on the chat in the presentation today. I'm an emerge doc, and I'm someone who's been paying a lot of attention to public health over the last 5 years, and prior to that, did a lot of work and continue to do a lot of work on climate, because I think these systemic problems like public health and climate, it's really important for physicians to be vocal and to share the science accurately and with as many people as possible, because we do have a kind of an information, maybe misinformation problem in the world these days. And so I'm going to try and get all the data right. I may not get it all perfect. A lot of this is stuff that I've had to brush up on. And part of that is because of how great public health is. We don't see measles very much anymore. I may have seen one early on in my training. I certainly haven't seen any in the last 20 years. And that's a really remarkable achievement for science and for society, and we can't forget that my lack of knowledge on firsthand involvement in measles is something to celebrate. So I do have some slides. I'm going to bring them up and talk a little bit about measles, because I think we all kind of have this intuitive sense of what measles is, but I do think the details are important. Measles is a viral illness. It's classically this rash that you see in these photographs here, just a spotted red flat rash. And so let's talk a little bit about how measles evolves. There's something called an incubation period. That's that period between which you're exposed and you start developing symptoms. And that's pretty long. It's actually 10 to 12 days. And that actually makes it pretty hard, because you have that period where you have no idea anything's going on. And then you start to get some symptoms. The symptoms that are classically associated with this are a runny nose, a cough, and red eyes, what we call conjunctivitis. So those three symptoms are pretty commonly associated with many, many viral illnesses. Fever is often associated with this, which is also very common. And then just before you get the classic rash, you can get these things called Koplik spots. And that's that bottom right photo. There's these like little whitey blue spots throughout the cheek, the inside of your cheek. And so if you have Koplik spots and you have a fever and you have a cough, runny nose, and red eyes, even if you don't have the rash, that's got to make you really worry that this is measles. The rash itself presents about day 4 after the other symptoms appear, and you're infectious from about day 4 days prior to the rash appearing to 4 days after the rash appearing. And that's what makes this a really hard infection to control. You really do have to have good contact tracing, figure out who's been exposed, and keep an eye out for those symptoms. The vast majority of people do okay, but there is a pretty high complication rate. In well-developed countries, the mortality is about 0.1%, so 1 out of 1,000. That's a lot higher in underdeveloped countries, and that's likely due to malnutrition and other factors. A lot of malnutrition, and that mortality can be anywhere from 1 to 15% in underdeveloped countries. Then there's other complications like pneumonia, which is 1 to 6% of cases, ear infections, encephalitis is about 1 in 1,000, and about 10 to 15% of people get hospitalized due to these complications. And that's a lot. And should this be an overwhelming outbreak that can really have an impact on your healthcare system. The risks for getting those complications is anybody over 20, anybody very young, under 5, and anybody who's immunosuppressed, among other things. Pregnancy is also a high risk. So that's kind of the background on what measles is and why we care about it. I mentioned at the beginning that this is, sorry, I got to advance my slide, that this is really one of the huge victories for public health. You can see the incidence of cases over time in the United States from when the measles vaccine was introduced. And essentially within 4 years, cases plummeted to about 1/10 of what they are, and now they're so small that they're almost invisible on the chart. So if you look at the upper right graph, it's actually the y-axis is between 0 and 1,200, whereas the y-axis on the big graph goes up to 600,000. So you can't even see these big bumps in infections on that bigger graph on the bottom. So where are we at right now? So in the United States, there's the most recent data on the Texas, New Mexico outbreak is about 256 cases. And there's 10 other states involved, but they have a lot smaller numbers. So you can see on this graph, the more recent graph, we're not even close to the 2019 numbers or the 2014 numbers. Those 2 years were very special because they had large outbreaks in close-knit, under-vaccinated communities. The 2014 case was a very specific Orthodox Jewish community. And the 2019 cases, I can't remember where it was, but again, it was an under-vaccinated community. So why do we care about this case, this period now? Why is there all these alarm bells? Well, I think there's 2 things that are really important to recognize. The first thing is we're still early on in this outbreak. We don't know where this is going. So even though we're quite a bit lower than 2019, cases are growing rapidly every week, and so we don't know where the max of this is. There is some concern about underreporting of cases. We've already had 2 deaths in the United States, one in Texas, one in New Mexico. The one in New Mexico is being investigated because it was in an adult who never presented to the healthcare facilities, and so the measles positivity came after they passed away and was through autopsy. The other thing that's important to recognize, is that this is not a phenomenon unique to the United States. Ontario, in my country, has had 372 cases, so actually 100 cases more than the U.S. 195 cases just in the last 2 weeks, so it's actually doubled in the last 2 weeks. So this is exponential growth. In our Ontario case, there's been one death and 31 hospitalizations, one ICU. And so this is a big deal. In Ontario, prior to this year, there had only been 101 cases in the last decade. So basically, we've had almost 4 times the cases this year this outbreak compared to the last decade. So, and in in Europe and Asia, we've had doubling of cases in 2024 from 2023. So, what could possibly be causing this? Well, I think it's pretty clear. It's one thing, and then it's vaccinations. This is some data from my own province, but vaccination rates have really plummeted since the COVID outbreak. There's a couple reasons for that. I think our instinct is to blame the vaccine hesitancy on what's happening in our misinformation age and our disinformation age, and I think that's a huge factor. But I also think we have to recognize that back during the periods where we were encouraged to stay at home, it was actually really hard to get your kid vaccinated in 2020 and 2021. And so that would have contributed a little bit. So in my province, we've gone from first measles vaccine of 86.5 in 2020 down to, I've got to move my thing, but I think we're in the 82% range. And that was in 2022. Our second vaccine rate is 74% in our province. And there are pockets of communities where it's much, much lower, down into the 30s for that second vaccination rate in my home province. So let's talk a little bit about vaccines. Why do we like the measles vaccine? Well, it's not perfect, but it's pretty close to perfect. If from a single dose of a measles vaccine, that's a 93% effectiveness rate. So that means that you prevent almost all infections. If you get that second dose, it goes up to 97%. And so that's a very effective vaccine. It means that there's still some people getting measles despite being fully vaccinated, but not very many. And almost no hospitalizations or deaths are associated with fully vaccinated people. So we really want to increase that vaccine rate. Now let's talk a little bit about misinformation. We know that the RFK Jr., who is highly involved in the new Trump administration, this is from an article just from the last couple of days in the New York Times, has really continued to denigrate the measles vaccine. There is a suggestion that any infections are due to malnutrition, which is incorrect. Malnutrition certainly makes an infection worse, but there's no evidence that if you're undernourished, that would increase your risk of getting infected. And in fact, there's not a lot of evidence for undernourishment in the people that are getting sick right now. There's also a suggestion that the measles vaccine is causing more harm than the measles virus. This is simply incorrect. Measles, just like anything in health, measles vaccine does have side effects. We can talk a little bit about those, but the impact of being sick with measles is much, much higher than the risk of being vaccinated. So there are some side effects. About 15% of people will get a fever following a vaccine. 5% will get a rash. There'll be some between 5 and 20% of people will get swollen lymph nodes. The things that we really care about, which can be more concerning, is aseptic meningitis, 1 to 10 per 100,000. Deaths are pretty much unheard of, and the evidence shows that what we really need to do as a society is get that vaccination rate above around 95% in order to get good herd immunity that prevents this from going through. Fascinatingly, around 2000, the WHO has declared all of the Americas, North and South America, as having eradicated measles. The only cases were coming imported from travel. And I'm wondering if these current outbreaks are going to put at risk that eradication status, which I guess in large part is almost a legalistic term. We have the same kind of misinformation coming from our province here, where our Minister of Health is not recommending that residents get vaccinated. They're basically saying it's a parental choice, and I think that is such an abdication of responsibility from our health leaders. Um, I think that's all I wanted to say about measles. I'm going to just briefly touch on one other health issue that's happening right now. And I know we're
Oh,
really
Joe,
seeing, yeah,
before you go to another topic, can we just answer the question from Marcia Cohen, Zaki? Are
sure.
measles variants a concern?
Measles variants. I am not a microbiologist. I have never heard of measles variants. I suspect there's only kind of one clade. It doesn't have um, that evolution that we saw, that rapid evolution that was happening in COVID. Um, but that being said, the fact that double vaccination gives you prolonged lifelong immunity suggests that that kind of variation is not particularly important when it comes to measles.
Okay, thank you so much. Those are all the questions in the chat that I saw about measles. So I think we're safe to move
Yeah,
on.
I think we'll have lots of opportunity to discuss. I mean, I have questions for our
Mhm.
co-presenters, so I'm sure there'll be lots of discussion afterwards.
Okay.
I just want to talk about the influenza outbreak. It seems like this was a worse year, or is a worse year than we've seen in previous years. Anecdotally, in my emerge right now, there is a lot of influenza A. There was a distinct peak in influenza A illness in my province in late December, which then dropped. Actually, I've got some data there. I don't know if you guys can see that in the corner, which dropped and then got much worse again, and it seems to be climbing exponentially. And this is very unusual. Usually, we have like this tall peak as it rips through our community of vulnerable people, and then it drops again. This is going to be a much um, wider flu season. And I think it just speaks to the fact that we know what prevents flu. If you look back at the 2021 data and even the 2022 data, the simple things that we were doing back then basically eliminated flu A and flu B for the most part in those 2 years. And and there was actually one variant of influenza B that completely disappeared off the planet. We eradicated it
Yeah,
thanks
we
to
got it.
our efforts. So it's still an argument for being cautious, stay at home when you're sick. Unlike COVID, there's a lot less asymptomatic spread with influenza. So you can really prevent that cascade of infections by not exposing other people when you have fever, chills, cough, and staying at home. Masks work. If you're comfortable wearing a respirator mask, that will for sure protect you. And for those people that are vulnerable and influenza rates are high, I would strongly recommend that in crowded public spaces. COVID, interestingly enough, is not a big deal at the moment. It's not a seasonal virus like influenza is. Well, at least we're learning that it seems to be seasonal in October every year when kids go back to school, but it's not a winter virus. It can happen any time of the year. And right now, at least in my province, and I understand in the United States, COVID rates are really low. But be aware of influenza A. I think that's all my stuff to share. So I think I'm passing it on to
Okay.
Yaneer.
All right. Well, thank you so much, uh, Joe, for that. It was very informative. So I think that's why there weren't very many questions because you covered the good stuff. So thank you so much. All right. Yaneer, would you like to bring us up to date on any updates or comments on COVID or H5N1?
Sure. Let me talk a little bit sort of generally first. Um, there's a bottom line that I wanted to say, and since the imperative is to give the bottom line up front, I'll do that. Um, we are in a period of time where public health is being diminished in its um, implementation. And part of the challenge, and this is just really very direct, is that when the public health efforts, which are collective efforts, are being reduced, the responsibility for people is on their own health and the health of others around them. And this creates a huge challenge and stress for people. I want to say that. I think that it's really important for people to protect themselves, to pay attention to information, clear information, and to work together with other people around them to build the ability to protect their health. And obviously, we are here because of this to help everyone, and we'll be doing what we can as as things develop to help protect you and others. I wanted to focus on, I can say a little bit about specific diseases, um, and then I will go back to sort of the general discussion. Um, in terms of COVID, the main current development is that there is a new variant that is growing in the world, in Europe, in the US, and that's LP.8.1. And as we know, the main reason why they're growing is they're taking advantage of new opportunities in the population to infect and to spread. So this is the next variant, and I do think that it should be mentioned that while Joe said it's low now, low doesn't mean not there. It means relatively low compared to when we have a peak, but even the baseline is quite significant these days. And so the key, of course, everyone should understand is that long COVID is growing in the population, um, and that multiple infections are resulting in increasingly poor health, or if you like, decreasing health, cognitive impairment, and organ damage. And we really need proactive engagement with infections. And this is not just long COVID, of course, reduction in quality of life, in health, and so on as a result of many of these different infections, including COVID and influenza and others, measles, whooping cough, and RSV, and so on. And so we really need to engage in a systematic effort to protect ourselves. As we've explained, there are 5 critical layers. Vaccines that are very powerful, for example, for measles and some other diseases, have been weakened for COVID. And this question that happened earlier about the issue of variants for measles, the main reason why it's not as important for measles is because there's not very widespread, right? Mutations and the development of variants happens when there are many infections because it gives rise to many, many opportunities for the development of new variants. So this is critical for our understanding of what's going on. The more we can prevent infections, of course, the less there'll be variants. But in the meantime, at the individual level, we have to use all layers of protection. Vaccination helps, and but doesn't prevent infections or long COVID. And the other precautions are super important: masks, ventilation, clean air policies, HEPA purifiers, and ventilation. testing for early identification in order to prevent transmission, and social distancing, or whatever is the right term for this. People haven't figured out what to use yet, including avoiding in-person interactions, remote meetings, avoiding indoor settings where there's lots of people, and so on. And so all of these tools really continue to be essential for us to protect ourselves in this context. I would say a little bit about H5N1. I've been asked to talk about it.
Oh, could
And
we just go to the couple questions for COVID? Okay,
sure.
great. So do we know if there's like what kind of COVID testing is being done in hospitals? Marcia Cohen Zaki asks. Do we know?
The answer is that it depends where. There are places, the in the fall, the National Institute of Health medical facilities instituted both masking and testing as part of their policies. The testing used to be a consistent policy on entry into hospitals, but it is no longer. And I'm sure that the testing is very patchy in terms of what's going on. There is some requirements for reporting now to NIH, and I don't know exactly the status of current implementations of this, but it is a requirement that was established in the fall, and that would mean that has to be some level of consistent testing. But again, the details of testing is poorly understood, and unfortunately, that means that we just don't know whether there's being testing, but I'm sure that it is, from what we know, it is not consistent testing.
Okay, Joe would like to add to that.
Please.
Joe?
I just want to mention how important it is, the testing part. It's become very hard, at least in Canada, to get tests. They were given out free. Now I think you can get it in certain pharmacies for paying for them. I'll just tell a little clinical story, and I'll try and anonymize it as much, not to identify it. But I saw a young person yesterday who's athletic, who got a positive test 9 days ago and came in because of huge autonomic dysfunction. Basically, whenever standing, heart rate would go up to 140, blood pressure would drop to 70. I've never seen anything like that before. And I didn't really have anything to offer because there's no treatment for that kind of problem, this autonomic dysfunction. I'm worried, and this is very unusual to have somebody come in and say, and I tested for COVID and I was positive. Most people aren't testing when they have illnesses. And so I'm worried that as we go along, I'm going to be seeing a lot of people as an emerge doc who have unexplainable symptoms that we can't tie back to a specific virus, and therefore things are going to be much more complicated as far as diagnosis and treatment goes. So I would encourage people to continue to test when they have viral illnesses. There's all sorts of weird things that are coming into the emerge these days that if I had a positive COVID test, I'd be able to go and say, oh yeah, well, of course you have this weird syndrome. This is well known for COVID, and therefore I don't have to throw the book at you. We can rule out the important things, but there is going to be a time where that's not going to be a possibility because we just don't have the testing.
All right, thanks. We have another question. What extent could immune system damage through repeated COVID reinfection have an impact on the body's ability to fight off measles, flu, and other infections? This is from Sally Witcher. Thanks, Sally.
Yes, thanks, Sally. Yeah, so the answer is in the question, right? We know that the immune system is affected by COVID. And by the way, the immune system is also affected by measles. But COVID is causing underlying damage to the immune system, dysregulation, meaning the components and their interactions are being harmed. And the effect of that, and with cumulative infections, we have to expect that this gets worse and worse, as people will have difficulty fighting off other diseases. We have an article describing some of the existing data on the WHN website in the Science Journal, if you look under the Science tab. But there's evidence, direct evidence, and indirect evidence from the fact that so many diseases are growing, not just the ones that are being fought by vaccines, where the vaccinations are decreasing, but much more generally, diseases are increasing globally. We also should be aware that if measles does become wider spread, it will also have population-wide impacts. Of course, on the individuals who are infected, it will have impact because measles has an effect of removing memories of prior infections or vaccinations. And by doing so, it makes those individuals more susceptible. Now, there are two effects of this. So let me just say this. There's effect on the immediate risk of infection and the ability to fight diseases. But there's also an effect on increased exposure because if many people have reduced immunity, then diseases spread more widely in the population, and there's much more chance for exposure. So we have a compounding effect of this immune effect, giving rise to widespread infection and ongoing deterioration of health. Again, being sick is an impact on health, but it also causes longer term effects, where long COVID is surely the biggest effect, but it's not the only effect of all of these infections.
So that there, Aurora Horstkamp has a question about immune amnesia. Do we know what percentage of patients get the immune amnesia?
There's a wide range in the experiments that have demonstrated, but the point is that it's like 50% is sort of in the range, right?
High.
So it
It's
means
high.
it's high. In
Yeah.
other words, you're going to lose a substantial fraction of immune memory,
Mm.
meaning that the likelihood of getting infected by a disease that you've already been infected by is much higher after a measles infection than it
Yeah.
was before.
And then there's a follow-up question regarding like if the child gets measles, or I would say even an adult, like do they need to redo their vaccinations? I don't know if Dr. Joe wants to answer that or if he has any
I think
idea.
that I think the point is that the information about this is limited, remember,
Yeah.
because we've been successful. We haven't had measles cases in any significant number, even tiny numbers have been around for decades. And so uh, while there's understanding of sort of the baseline of behavior of measles, details of what's going to be happening now, and again, especially in the context of a widespread compromise of immune systems anyway,
Yeah.
this is something that we will have to find out. But
So,
it should
so
be understood. Go ahead,
Yeah.
Eric, if you want to answer.
yeah, about the measles immunity amnesia, I just want to highlight it's like it basically wrecks anyone's immune system to some degree. And if depending on the severity, that's where the variability is. But even if you have, a milder case of measles, to a severe, and it wrecks anywhere from the study from again, it was pre-pandemic study from 2019. It wrecks anywhere from 11% of to 73% of a person's antibody stockpile, and which the antibodies to pre-existing diseases. So it's pretty. It's like it's not like from zero to some. It's literally wrecks almost everyone's antibody stockpile to some degree. Again, depending on the severity. So there's nobody who like really escapes from it. It always destroys some part of your immune system's memory against these other diseases. So that's why I really emphasize it's not like only half the people will be affected. It will affect everyone, and the degree will determine, based depending on your baseline immunity, some people do have a stronger immune system that will determine whether you get infected by other diseases that you've been previously affected to. So I think that's where the danger is. There's no escaping into some, everyone's going to get hurt to some degree. And in certain ways, I often try and focus on like, how do we convince people, right? Because you can say, well, because people should say, well, the risk of the vaccine is blah, blah, blah. You can, to some degree, I can tell people that there's no link between that and autism until the cows come home to some of these anti-vaxxers. They won't listen. But I emphasize is like measles is kind of like it works. You need to give people analogies. It kind of is like almost like an HIV infection in terms of it actually decreases your immune system, right? Makes you immunocompromised against all the other diseases. So, and these are the things that don't show up in adverse event databases, that don't show up in the clinical trials because the clinical trials are pretty short. You don't see the long-term consequences of being therefore immunocompromised and therefore susceptible to tuberculosis and a flu and a whole slew of other things many seasons down the road. And I think that is also like one specific angle of like, do you want to basically have a partial HIV type of infection, in which half of your immune system is wiped out against previous diseases? And normally, if you explain it that way, they'll automatically understand because they understand the analogy with HIV. And so I
Well,
just
okay,
wanted to
let's
put that out there.
thanks. Thanks, Eric. No, it's good that we have some details on that. Yeah, there's questions about wondering about the waning efficacy of the measles vaccine, um, over time. And I think we were going to address that, or did Joe already address that sort of scenario? I think that's a question on a lot of people's
There
minds.
is some
Yeah,
waning, but it is very robust. In other words, the problem is, of course, that it's been a long time since people have been vaccinated or vaccinated as children. So the fact that there is a reduced immunity may play a significant role in the current context, but it is still a very robust vaccine.
right. Although a
Um,
lot of people didn't get a second shot prior to 1989 in the United States. You only got a second shot after 1989. And so I want to emphasize that, one shot theoretically, waning aside, it's about 93% efficacy, but with two shots, you up to 99. So I think it's worth it. Whether
90,
you,
I thought it was 97.
well, it's higher. It is much higher. And
Okay.
some people say the one shot is 90. So there is a boost
Okay.
um, with a second shot. So I think that's where we really want to emphasize that getting the second shot, it's not like a huge amount, but it is an appreciable amount. And I always tell people, do you want, a 3% chance of failure, or do you want 10% chance? If you, in certain ways, if you frame it that way, you're talking about a threefold difference, right, of likelihood of catching it. And if you say you want threefold less, yes, then they'll usually get the second shot. And again, a lot of people prior to 1989 only got one shot. And if you got an older measles vaccine between 1963 67, that was a very, subpar defective vaccine. You should definitely get revaccinated. So those are the recommendations in terms of getting a second shot. And if you don't have a record of it, just get another shot if you're unsure.
I'll just mention that the public health agencies in the United States and Canada and elsewhere all have recommendations on this. I'll see if I can find those recommendations because they may be regional differences. And so I'll see if I can pop that in the chat.
That would be super helpful. All right. So we've got some questions in the chat. Yaneer, where did you leave off? I'm not sure if we should go to questions or back to you.
I am fine either way, whatever you'd like. And in fact, I can maybe I'll just summarize a few things briefly and
Okay.
then go because Eric should be we're advancing in time.
Yes.
Um, uh, I was asked to update about H5N1. Let me just say that recently we're just sitting on the edge of the cliff, right, or standing on the edge of the cliff with respect to H5N1. There haven't been major developments in the last couple of weeks, maybe, but the biggest situation is with the infection of cattle by the D1.1 variant that is more severe, and reinfection of people from the cattle, and the fact that there have been several studies that have shown that many more people have been infected by H5N1 that were identified individually when they were sick. So that's the kind of status that we're in right now, but we are pending, unfortunately, the fact that we are not taking adequate action to prevent the next stages of widespread infection. That's the issue. I think that I will stop there. I think I'll hand it over to Eric for his discussion. And again, let me just emphasize what I said at the beginning, which is that under these circumstances, we really have to be proactive in our precautions because we do not have adequate public health engagement on the part of the institutions that are supposed to be doing so. Eric, please go ahead.
Yeah. And I want to just add about the measles vaccine that you shouldn't get it if you're pregnant, while actively pregnant. And of course, if you're extremely, extremely immunocompromised, you shouldn't get the measles vaccine because it is an attenuated. It's not an inactivated. It's an attenuated, as in it's a weakened a form of the virus. So so for those who are extremely immune compromised, you shouldn't just willy-nilly get another shot. But for others, I think getting a second shot is a very wise idea. I want to just talk about, like, obviously there's a lot of policy issues, and I always want to emphasize that unlike the pure hard science of just only have to deal with the lab issues, public health is policy. Policy is politics. So public health is a scientific field, but in which you relies on a lot of policy to carry out the life-saving methods in public health. And obviously, politicization isn't good, but we have to live with that reality. It's that these policies are set by politicians most of the time, or politically appointed people like RFK Jr. And so right now we're entering obviously very dark times with a lot of misinformation. Obviously RFK, he wrote that op-ed that you should get your measles vaccine, but he's never actually said it live in person. So he's written that, but he's never said it live in person. You should get the measles vaccine because it's very important. And in the op-ed, he kind of like diluted it down where it's a personal choice. And of course, you should get vitamin A. Vitamin A, it does boost the immune system, but only if you have vitamin A deficiency. And so a lot of the studies that shows vitamin A helping against measles is in studies in Africa and in South Asia, where a lot of the malnutrition is very severe. And that's where a lot of the Harvard and Johns Hopkins studies on these were carried out. Most Americans are not deficient in these vitamins, in these common vitamins at all. That's why most multivitamins have limited efficacy in the Western diet. So for him to emphasize that over measles vaccination, which is obviously with huge efficacy, is just ridiculous. And I can get into seed oil, I can get into his beef tallow kind of stuff later. But when he says the personal choice thing, and this is a broader topic beyond just measles vaccinations, personal choice is important, and I believe in individual liberty. But at the same time, I emphasize, look, we mandate seatbelts, and we don't give you the personal choice to drink and drive, above a certain alcohol limit. We don't give you the personal choice to smoke in public restaurants and on airplanes. Why is that? Well, the thing is, like, your right to smoke and puff air, because secondhand smoke causes disease, heart disease, cancers, and whatnot, stops at my nose. So if what you do affects others around you and harms others around you, if you do or do not do something, then you actually do no longer live in this bubble of my body, my choice entirely anymore. And so I want people to take away from this talk that when you talk to others about they always say, my body, my choice. That applies to things in which you have no other adverse effects on others. But when it's puffing cigarette smoke into a restaurant and giving other people secondhand smoke and giving them disease, or drunk driving, which is obviously illegal, that you endanger other people. These personal choice things, drinking and driving drunk, is no longer just a personal choice; it's a public health issue, and that's where I get into the vaccinations of when RFK Jr. says, vaccination is a personal choice. Well, that obviously viruses spread, and airborne measles is very contagious, just like COVID is very contagious and flu is contagious. You're right to do anything or willy-nilly to yourself. If you want to stuff your body with, a cheeseburger and pretend it's healthy, which I say this jokingly, but RFK Jr. actually did this earlier this week, claiming, "Oh, look at this beef tallow fried thing. It's healthy." It's not, but in certain ways, that's between you and your arteries, and of course, public health dollars to pay for it. But that's the public health, that's a different issue. But for measles vaccines and other vaccines, herd immunity is important. You protect people who are immunocompromised, who have legitimate religious exemptions, of course, and of course babies under 6 months who oftentimes can't get vaccinations immediately. And so I think that's where we have to emphasize. Give the analogy to something that they understand. Secondhand smoke. That's not just a personal choice. Drunk driving. That's not, you can't do those dangerous things to other people. And I think vaccinations is one of those things where it's not a personal choice, because you not doing it endangers others. You not vaccinating your child endangers others. So when a public school has vaccine requirements to attend public school, it's not the government being, a dictator. It's government protecting the society as a whole, just like it has drunk driving laws. And I think that's how we should um, explain and emphasize um, immunization mandates, because it's to protect others around us, and that your personal choice is not just a personal choice. You are actually endangering others. You're not just endangering your own arteries, well, by doing something unhealthy. I think that's where we have to really try to convince and flip hearts and minds of people beyond just, debunking, oh, there's no link between vaccines and autism. And finally, I want to say a note that, earlier this week, RFK Jr. says he's going to demand that CDC or NIH conduct a large study on vaccines and autism. First of all, there's decades of research that shows there's no link. All these other retracted studies aside that have been debunked, there's no link. A recent Danish study actually shows vaccinations not only has no link, but actually may lower the risk of autism. And it's a national Danish study, and Danish national health database is very strong. But we got more details. They're apparently relying on the CDC data called the Vaccine Safety Data Link, which is a real-time electronic medical record system in certain areas. It's in California, the Kaiser Permanentes, in Colorado, Oregon, Wisconsin, Indiana, Boston, Harvard Pilgrim Healthcare, and Kaiser Permanente Mid-Atlantic region. But I want to emphasize a lot of times what I worry about this data set is that it's not national in scope. It's not like the Danish study where it literally was national, but it is vulnerable to cherry picking. In epidemiology, there's something known as, yeah, other people have heard of this called p-value hacking, or you can cherry pick results. Overall, the results find nothing, but you can cherry pick a subgroup. Well, in women or men under a certain age, among this ethnic minority subgroup, if you find enough subgroups, if you chop it up into like 50 or 25 subgroups, statistically you're going to find one. Sometimes, because just a 0.05 p-value significance just means that 1 out of 20 times, 5%, you'll find something. So I worry that they'll try to p-value hack and find some something significant. Because in the past, I know that they found in the same database a link between um, a Pfizer vaccination and stroke in men, Pfizer COVID vaccination. But once they replicated it and checked, well, it wasn't with anything else, it wasn't in women. And once they checked nationwide in other databases, they didn't find it. But if you, in the limited small data set, when checking all these subgroups and all these different disease endpoints, you could find something. And I think this is where we have to be very alert that the RFK Jr. probably will p-value hack, demand that they p-value hack every single subgroup, and I think they might find something based on p-value hacking these and cherry picking the subgroups. And so that's my quick aside. But I think overall, when we talk to people with vaccinations, emphasize the analogy with drunk driving and secondhand smoking, because that is how we will win hearts and minds and make them understand the importance of vaccinating anyone, and beyond the it's just your personal choice argument that RFK Jr. seems to always emphasize.
Yeah, thanks, Eric. There's one question for clarification. Since herd immunity, the phrase herd immunity has been uh, misused or misrepresented, since COVID came. Can you just describe more about measles, the
Well,
vaccine, and herd immunity in that regard?
right. So herd immunity threshold depends on obviously the efficacy of the vaccines as well as the contagiousness of the virus. And it's basically if you're over 95%, because it's highly contagious, you need 95% vaccination immunity rate in order to protect the remainder, just to make sure it stops transmission. If you're less than 90, you're gonna be very ineffective for slowing. Now, herd immunity just means that, for example, if you're in a big ballroom and someone on the other side of the room has a virus, and you're not immunized when you're on this side, the chance the virus can hop, skip, dance through the ballroom to get to you on the dance floor is lower if 95% of people in the ballroom already has it. The virus is nowhere to go to get to you. But with less vaccination, less immunity, the chance that you'll hop, skip, or across the room is much higher. And so you're protected if the herd immunity threshold you're above the herd immunity threshold. And I think that's generally the analogy. But again, you have to also realize that you can't just go by a national or state statistic on how much percentage of population has been immunized, because it's about the pockets. If you have, for example, the Mennonites, the unvaccinated Mennonites, well, if the vaccine levels are so low, statewide it could be higher, but if in those pockets it's so low, all virus spread is local. So it's not about if as long as your statewide is high enough. It's about what is in your neighborhood community around you. That's what really matters. And if you're in a very low vaccine area, like a lot of rural areas, especially rural Texas, then that makes you very vulnerable, even if, Dallas, Texas has high vaccination rates. The rest of Texas does not.
Let me just add one quick thing. The reason why herd immunity has been a key issue is that it critically depends upon how robust and persistent is the effectiveness of the vaccine. So this conversation makes sense for measles. It doesn't make sense in the context of COVID, where we don't have persistence or efficacy of the vaccine. And this is one of the key issues. And should be understood because, for example, flu vaccine doesn't last till next year. And people who have studied flu vaccine for a long time, and many people have done so, should have known that it shouldn't have been assumed that COVID would have the kind of efficacy and persistence that it does, that the measles vaccine does, as an example. But they assumed it and were focused on it and claimed that it would be fine that way. And when it didn't work, It was surprise, which is not consistent with the nature of how things work.
Right. This
Thank you.
assumes that all immunity is robust and does not wane, and which was very, very much not true during the COVID era.
During the
All right, so there
present.
are some questions still lingering about very specific questions we're getting that I don't think that we could advise on as we're not your um, direct doctor, but there's a lot of questions about personal situations regarding immunity, titers, getting vaccinated with immune compromised conditions. I would definitely advise everyone to speak to their primary care provider about what the best course of action is for you. But generally, there are titers that you can get that will give you a value of your IgG, your immune status. And you can ask your doctor for the MMR IgG panel um, if you feel that's something you want to pursue. And I believe Joe had a couple of things he wanted to wrap up. Are you okay, Eric, if we switch to Joe?
Yeah, go for it.
Okay.
Yeah, I just want to continue riffing on this idea of herd immunity. This was the idea behind the Great Barrington Declaration that if we let COVID rip through enough of the unvaccinated population, that they would become robustly immune, and therefore the remainder of the vulnerable population was going to be protected by that herd immunity. And that was flawed for many reasons. But the first thing I want to point out is that herd immunity was never intended to be a tool for natural infection. It was always intended to be associated with vaccines, and that those vaccines had to have robust effectiveness, as Eric had said, in order to work. And that's never been the case as far as infections go with COVID. Or the vaccine. So then they switched to this idea of hybrid immunity. So if you had a vaccine and you managed to get COVID, that combination of things was supposed to provide some robust immunity. But again, we're seeing people in the emerge that have had COVID despite the vaccine 2, 3, 4 times, and that some of those impacts, those long-term impacts, are coming despite the vaccinations and previous infections. So it's really important to understand that it's being misapplied in the context of COVID. I will say that the COVID vaccine is important. It decreases hospitalizations, deaths, and drops your risk of long COVID by about 50%. I think the vaccine is incredibly important for everybody to have. I think we're still learning as to exactly how to do that schedule, and there's different recommendations from different organizations. I personally am getting the updated vaccine at least once a year, and in times of high community transmission, I'm giving myself a second vaccine. I also work in a very high-risk field, being in the emergency room, so that caveat. I do want to say one other thing in regards to measles, which I forgot to mention, that there may be some people that are participating in this town hall, or know people who have not been vaccinated, or who kids have not been vaccinated. And there is actually the ability to do post-exposure prophylaxis of measles. So you get exposed to somebody with measles. If you get the vaccine within 2 days, it actually will be effective at preventing you from getting measles. And you have the ability to get immunoglobulins up until 6 days after exposure and prevent the measles vaccine. So if you're not vaccinated, get vaccinated. If you're exposed, there are ways of avoiding the disease.
Well, thank you. Those are very comforting and important points regarding post-exposure treatment. So thank you so much, Joe, for that. We're going to be wrapping up here. I appreciate everyone's time. Please check us out on social media and our website, whn.global. We have a warm, welcoming community. We have teams that work on different projects, and we welcome you to join us. And we get together every day at 5 o'clock for our daily call to get super up-to-date updates and great community discussion. So please reach out to Sharon at nexi.edu if you're not already a member and connected on our Slack, or if you have any general questions, please do reach out. Thank you, Yaneer. Thank you, Eric, and thank you, Joe, so much for joining us today. We'll be having another town hall very soon, next month, and we'll keep everyone posted on that. So thanks to all the speakers. Thanks, Sharon, for your help coordinating, and thanks everyone for tuning in. Take care.